we've seen significant investment into research on the causes of autism. But I'm actually not that interested in what causes autism. I'm interested in what autism causes in terms of healthcare. So, what's the big emergency? Practically every week, I get a phone call from a family of an adult on the spectrum desperately seeking services. Sometimes they're fighting to get their way into a hospital, and sometimes they're struggling to find their way out of the hospital. You see, children with autism grow up to be adults with autism. But if you look at how our adult healthcare system is structured, you'd think maybe they didn't know that. On the adult healthcare agenda, autism is largely invisible. We just don't see them. Now, there are different ways we can look at this. The first is that we, healthcare providers, don't see them or won't see them in our healthcare practices. Here we have a problem in terms of access. It's one thing if we can't go to one healthcare provider and we need to move along to another, especially if it's down the hall or across the street. But what happens when there's no there for individuals to go to? When they're told repeatedly, we're so sorry, we don't see them here. Oh, autism, we don't see them here, but I'm sure you could just go there. The truth is, when healthcare issues aren't addressed in a timely manner, they don't just go away, they get worse. So, we end up having problems that lead to emergency department visits and hospitalizations, many of which could have been avoided. We don't see them can even be a problem in the hospital. Take Andrea, for example. With a bee sting and a severe reaction to the bee sting, going to the emergency department and told she needs to go to another emergency department. It's not that they can't treat the bee sting, it's that they can't handle the autism. Or Paul, very unhappy and increasingly violent at home with his parents. After 3 failed emergency department visits, they make the decision to put him in the back of a police car by himself and send him to the hospital, hoping that maybe then he'll get admitted. And he does. At the heart of this problem is the reluctance of healthcare providers to offer the healthcare that is needed when it's needed. But it's not because they're unkind or they're uncaring. It's because they simply don't know how to do it. The solution here is we need to increase our training so that all healthcare providers know how to provide services to people on the spectrum. And when we think about how we do that training, it's not enough to just offer a lecture to talk about it for a short time. We need to offer hands-on experiences that are positive, that involve people on the spectrum, so we can see how to provide good care and we get inspired to give that kind of care when we ultimately work in the healthcare profession. I think we already have a lot of resources that can help us to do that kind of teaching. The challenge is we need to figure out how to get that into practice. We have a second problem. We don't see them. Here, the issue is we don't see them because we're not aware of the fact that they have autism. Now, why is that an issue? It's an issue because when they go into their healthcare setting, if we don't recognize the autism, we're not going to provide the care that we need to. Now, you might think, what's the big deal? Especially if showing that you have autism means you're going to get worse care. Why would you possibly want to make that known? Well, if it was known and it could actually change how your care was provided, maybe then you would think about it differently. There are solutions to this as well. I'm proposing that what we need to do is set up a flagging system so that everybody who comes into a healthcare system with autism gets known. And going with that notification of the autism has to come a second piece, which are clear and simple tailored tools for anyone working in that healthcare setting to help them know what they need to do a little bit differently. Just imagine, if you will, somebody comes into the emergency department. They have autism. It pops up on the computer screen, and it reminds the triage nurse to ask the questions a little bit differently. to offer a social story that explains this is the kind of thing you can expect if you're in our emergency department. And then it notifies the next nurse who's doing the assessment, and it also reminds the emergency physician, these are the common medical issues that often get missed for individuals with autism. Please screen for them. Even if they're not saying that they're in pain, there could still be an issue. It also could notify the social worker. Maybe the person came in and they didn't have a crisis plan in place. So before they leave, the social worker needs to sit down with them and say, okay, let's work on a plan because you might come back here another time and we want to make sure we know you really well. Okay? So seeing them can actually lead to a difference in terms of how care is provided. And the final problem is that we don't see them. You see, autism and all the health issues that are associated with it, whether they're medical issues or mental health issues, they can be kind of complex and very overwhelming to the person, to their family, and also to healthcare providers. So much so that what can happen is the healthcare provider focuses on the problems and they miss the person behind the problem. So the solution here, there's a couple. One is really increasing and promoting our public awareness with events like TED Talks where we talk about what autism means and who people are with autism, but also at the individual level. We can really change our healthcare interactions if patients are known well by their healthcare providers. And not just known because of that one disastrous issue that's come up that they're being treated for right now, but known for what they're like outside of the healthcare setting. So that can include bringing in pictures, stories, even a video on your smartphone showing this is what things are like when I'm at home or before the situation happened. It allows for a conversation between the healthcare provider and the patient or possibly their family. It makes for a better assessment and better treatment, and it also makes it more likely that that person is going to come back to healthcare next time they need it. After all is said and done, a lot more is said than done. That's what a father said to me once many years ago when I was giving one of my research talks. It's very easy for me to stand here in front of you and talk about some of the things that are wrong with our healthcare system and even offer suggestions about how we can change them. But the truth is, we need to move from the words about what we need to do into the action. So we need to make sure that every individual with or without autism can access the healthcare services that they need when they need them. We need to make sure that their autism is recognized and that their healthcare is modified appropriately. And we need to make sure that we see the whole person in our treatment. And I believe that if we do these things by bringing policy, practice, research, and advocacy together, we really can make a difference. Thank you.